The milieu is a French word for the environment. In this case, we refer to the therapeutic environment as the milieu. Also, think of it as the unit that you're on. We hope that all of your units are therapeutic. Some may be more so than others, but as you get adept at psych mental health nursing, we may be asking you to evaluate your units in terms of their therapeutic effectiveness. That's for later on. But for now, let's take a look at what a therapeutic milieu is supposed to be all about. First of all, it's good to know that it is the job of the nurse to maintain the therapeutic environment. Since psychotropic meds became the order of the day, there has been less in the literature written about the therapeutic environment, which is somewhat of a shame. Maintaining a therapeutic milieu is based on a belief in the validity of the assumptions listed here. This is a multidisciplinary effort. No one discipline can do it alone. The milieu needs to be monitored and evaluated constantly to make sure the unit culture is therapeutic. This is no easy task. Milieus are very complex. Skinner's 7 assumptions are important in understanding the value of the therapeutic environment. Nurses must be positive and believe that patients can be helped. Nurses must believe that all patients have strengths. Even the sickest, most disorganized schizophrenic has the ability, the power to live a better life if they adhere to the therapeutic process. Every interaction between the nurse and the patient can be therapeutic. Nurses must give immediate feedback to patients. Just like when raising your children, immediate feedback is necessary. One cannot correct a child about something that a child did today, tomorrow. Keep that in mind. A client owns his or her environment, autonomy. Autonomy is very, very important. Patients should make decisions about themselves, should be able to problem solve related to their own behavior in their own unit. Patients need to take responsibility for their own behavior. Peer pressure is very, very important and a powerful tool. Behaviors need to be dealt with as soon as they occur. Nurses should sit down, debrief situations with patients, discover what happened, discover how it affected them, how it affected others, explore with the patient what they could have done instead. We do believe that restrictions and punishment are to be avoided. Now, keep in mind, if needed, restrictions such as temporary isolation or sitting a patient alone in their room or be accompanied by a nurse sometimes is necessary to decrease stimuli. So it is situation specific in terms of what we decide. 5 functions of the milieu have been identified. The first, containment. These are the basics: food, shelter, clothing, safe from harm. The second is a supportive environment. Patients need the presence of a team that provide encouragement, help, feedback, a team that uses the techniques of therapeutic communication to help patients realize their potential. The third function of the milieu is structure. This refers to growth-producing activities, a schedule of opportunities in which patients can try out new behaviors. The fourth is involvement, a combination of encouraging patients, or requiring patients, using a point system, a reward system. In some settings, a hierarchy where patients can assume roles in the setting. This is most often done in rehab types of facilities where patients stay for longer periods of time. The last function of the milieu is validation that is honest and real, treating the patient as an individual with his or her own strengths, weaknesses, and characteristics. The first goal of the milieu is reality testing. Many of our patients will have an unhealthy view of reality, a distorted view of reality, thoughts that are unreal. Our job as nurses in the milieu is to enforce reality by providing an accurate view of reality in an accepting and calm way, describing to the patient what our perception of reality is, and to attempt to determine the difference between the patient's perception and the nurse's perception. We'll talk more about this as time goes on. Another goal of the milieu is limit setting. Clients want to trust that the nursing staff will help them control themselves and their own behavior. Therefore, rules are necessary, and nurses will be in many, many situations where it requires them to step up to the plate and set limits on clients' behavior. Another goal of the milieu is social skills training. Patients need a safe place to get feedback from others about how they come across and how their behavior affects other people. So the therapeutic environment is an arena to try out new behaviors. As you go into your clinical settings, take a look around and decide if your unit fulfills the criteria for a therapeutic environment. Remember that this is where the patient learns to function effectively outside in the community. This is the arena to try out new behaviors. It takes a village to do all this. It is truly an interdisciplinary team approach. The psychiatrist, clinical psychologist, the clinical nurse specialist, the nurse with a master's degree or above, the baccalaureate level psychiatric nurse, the mental health technician, the social worker, occupational therapist, recreational therapist, music, art therapist, dietitian, all play integral roles in helping the patient live his or her best life. Remember, management of the milieu is the jurisdiction of the baccalaureate nurse, along with the following listed items. Every unit will have a policy and procedure manual. In it, you can read, learn about everything that is done on the unit. So I do suggest that on your particular units that you seek out that manual and check it out. Regarding client government systems and STEP or privilege systems, as I said earlier, this is more apparent in longer-term settings such as rehab settings. You will experience community meetings and groups in which clients are given the opportunity to speak up, speak their piece, and have a voice in what goes on the units. Discharge planning is ever so important in psych mental health settings, as in others. We have a tremendous revolving door problem in psych mental health, making follow-up extremely, extremely important. This is our opportunity to see that patients are staying on their meds, that they're seeing their healthcare provider in order to avoid that revolving door. I hope that your experience on your assigned milieu proves to be growth-producing and productive. Good luck!